But I never realized how many people it happens to and how nobody really talks about it and nobody really shares when they have a miscarriage.
I think there's a lot of pressure sometimes for people to get pregnant. And so when it happens or a miscarriage happens, people don't want to talk about it.
Embarrassed and also guilty, right,
Yeah.
Janet? Like they did something to cause this, and that's why they don't want to share it.
You hit the nail on the head. There's a lot of different emotions that come up.
About 80% of miscarriages happen in the first trimester. These are not causes like that the patient did something, like did a hard workout or ate something that caused the miscarriage. There's usually some either that chromosomal issue or something underlying that, none of us knew until the person was trying to get pregnant.
This is Birds.Bees.Bodies, the podcast where we strip away the myths and get real about sexual and reproductive health. No shame, no stigma, just truth, guidance, and conversations that matter. Powered by Planned Parenthood of Florida, we're here to break barriers, challenge the silence, and give you the knowledge to take charge of your health and your future. Let's go. Hi, everyone. Welcome to another episode of Birds.Bees.Bodies, Season 4, brought to you by Planned Parenthood of Florida. We are so excited to keep chatting with you. I am your host, Michelle Quesada, Vice President of Communications, Brand and Marketing for Planned Parenthood of Florida. And today I have several co-hosts and guests with me today to talk about miscarriage. And it's been a very heavy topic, something that we don't hear a lot of people talk about. There's a lot of shame. There's a lot of support out there as well. And we really want to have a discussion today to shift the narrative around pregnancy loss. So joining me today is Dr. Robin Schickler, our Chief Medical Officer for Planned Parenthood of Florida, Christina, our Vice President of Organizational Development and Culture, and Janet, our Behavioral Health Program Director. Welcome to all of you. And all of these guests really have a different set of expertise and perspectives to this conversation that I think you all will really benefit from today. So I'll start off with Dr. Schickler, and you've all heard from Dr. Schickler before. We've had her on for the Pink Project podcast. If you haven't heard that episode, you better go check it out. So let's talk about for a second about what is a miscarriage and how common is it? Because, we hear miscarriage all the time and people have different perceptions of what that means.
Absolutely. So a miscarriage is, in simple terms, a pregnancy loss. It can happen in the first or second trimester, and we still call it a miscarriage, but it's a pregnancy loss. The medical term for it actually is spontaneous abortion because it means the pregnancy is gone spontaneously. There's other different terms for when the pregnancy does not pass on its own, but generally we use the term spontaneous abortion for miscarriage.
And this is something that's very common, right?
Yes. So miscarriages, spontaneous abortion, missed abortions are very common. There are some different rates out there if you are out there reading, but it's somewhere between 10 to 15% of clinically recognized pregnancies. That means like they came in, we recognized it, we knew there was a pregnancy, and then they had a miscarriage, or we see the miscarriage. That doesn't include, someone who maybe knew they were pregnant at home and then had a miscarriage, but never made it into a provider. Also, some of these happen really early that someone might not even know they were pregnant and maybe thought it was a late, long, heavy period.
And so I wanted to bring in Christina and Janet because when you hear the term miscarriage, right? And this was something that, I learned a lot about after when I started to try to get pregnant with my first son, my first pregnancy. And, I had heard about miscarriage, and I had heard that, that can happen to you early in pregnancy, and even in the second trimester. But I never realized how many people it happens to and how nobody really talks about it and nobody really shares when they have a miscarriage. Christina, I wanted to bring you into this discussion because I feel like there's a societal stigma to it, but there's also a cultural stigma to even talking about miscarriage.
Absolutely. And I would say that's a big thing, especially in the BIPOC community, right? And I think in any community, like culturally, it's some things when you talk about abortion, whether you talk about a miscarriage, there's some things that people just don't talk about. I think there's a lot of pressure sometimes for people to get pregnant. And so when it happens or a miscarriage happens, people don't want to talk about it, right? It could be for religious reasons, socioeconomic reasons, but these kind of cultural disparities is one of the reasons, right? You have this huge stigma around miscarriages, and sometimes people just outright embarrassed, right? Especially if they've been trying for a long time, that can be tough on folks.
Embarrassed and also guilty, right,
Yeah.
Janet? Like they did something to cause this, and that's why they don't want to share it.
You hit the nail on the head. There's a lot of different emotions that come up. And it's interesting because depending on the person and their situation, the emotions can vary wildly, right? You may have some people that have grief and shame. You may have others that have feelings of relief. And yet you have others that are completely numb. They have no feeling, no thought about it. They just kind of want to move on. So it's really very individualized to each person. Um, and it's very complex. It's not something that, grief is not something that's linear, right? We bounce from one cycle to another. Sometimes we feel like we're doing great and, I haven't thought about that in a while and I'm moving forward and then a smell, a song, somebody introduces themselves to you and that was the name that you were planning on giving your baby, right? Like so many different things that can trigger that grief again. And that just means that you're still healing, right? And that your heart is still grieving a little bit. And it's all a normal part of the process. But we see that across all cultures.
Yeah. Dr. Schickler, is there anything like, and maybe the second trimester miscarriages, there might be a little bit more to go on, but I feel like the first trimester, early pregnancy miscarriages, you're trying to figure out the reason why it happened, and sometimes there really isn't a reason.
Yeah, that's right. So about 80% of miscarriages happen in the first trimester, and the majority of those are what we consider sporadic chromosomal issues. So something happened when the cells were splitting that just didn't go right, and so the pregnancy, kind of resolves itself because it had that abnormality. But there are, that other percentage that we don't really know, particularly with the first miscarriage. Once someone has had two or more first trimester losses, or they've had a second trimester because it's less common, there may be some other cause. But important to note that these are not causes like that the patient did something like did a hard workout or ate something that caused the miscarriage. There's usually some either that chromosomal issue or something underlying that, none of us knew until the person was trying to get pregnant.
Yeah, so many other health conditions that could interfere. Thyroid issues. I have thyroid issues. And I'll share a story with you all. So when I was trying, my husband and I were trying for our first child. We were trying, so we were testing every single day, like, a few days after, thinking, okay, this is it. And we found out immediately the day I was supposed to get my period, I tested and it was positive. So it was right at the 4 week mark, right? Because I was calculating my menstrual cycle at this point. And we're so excited. Of course, we told our parents, we were thrilled. We were pregnant. And almost a week to the day later, a week later, I start to get my period. And turns out it was probably a chemical pregnancy, right? It was a false pregnancy. It actually really didn't, I wasn't really pregnant, or maybe I was at some point, and there was, like you mentioned, some sort of cell issue where I ended up losing the pregnancy. The second time I got pregnant, we were so excited again, but we didn't tell everybody, and went to do our first ultrasound. And got an ultrasound, saw the pregnancy in the uterus. Everything was going great. We got cardiac activity. Everything was great. And 2 days later, I start to experience really bad menstrual cramps, and I start bleeding. And we went to the ER and learned that there was no longer cardiac activity and I was having a miscarriage. But hours before that happened, I had done a workout. And I hadn't worked out the entire time that I learned I was pregnant until that day. And so that kind of stays with you, right? Like you think you did something wrong. And it took me a long time and talking to a lot of doctors and reading up to realize that's not the case. My thyroid levels were completely off the charts. And that could have been a contributing. We don't even know if that was it, right? That could have been a contributing factor. So once we got thyroid under control, did some further testing with my husband to make sure quality of sperm and everything was great. We ended up getting pregnant with our son Mickey, who's now 3 years old. And so, it's a story that I share because right away I thought, oh my God, what's wrong with me? My body's failing me. Like there's something wrong with me, and I'm thinking I'm going to have fertility issues. Not that there's anything wrong with that, right? Because it's called fertility. A period of infertility doesn't mean that you're infertile. It's a period of infertility. And so I wanted to share that just to let people know that, sometimes you think that is something you did, but really there's so many other factors, and it could be an underlying health condition that you didn't even know. That's why it's so important to see a provider, like you mentioned, if you're having repeat situations. What I wanted to share too is that there are ways to help you through a miscarriage, right? Because some folks think like if you're having a miscarriage, you have to go through this alone at home and just do it at home, and that's not the case. You can seek help. What options are there, Dr. Schickler, for folks who are going through this and unexpectedly, and sometimes you're bleeding and you're pregnant and everything's fine too, so you should get checked out.
Hmm. Yes, that's exactly right. So always a good idea to get checked, because sometimes you're right. You could have some bleeding and we don't know why, but everything's fine. When we do diagnose a pregnancy loss, there are typically 3 options that we give patients. Certainly some people just start to pass on their own. So one of those is expectant management. About 80% of people will pass the pregnancy within 8 weeks, which might for some people be too long of a time. But many people just want to go home and try to pass it on their own. Another option is medication management, where we give the same medications actually as an abortion pill, and that helps them pass the pregnancy. Or we can do a procedure like a D&C, where we remove the pregnancy tissue. And it's really up to the patient. Certainly, if it's an emergency, they're having a lot of bleeding, we might say we need to do the procedure, but it's really up to the patient and their own desires.
And that's hard too mentally, for a patient who sometimes they know the pregnancy is gone and they want to get through that healing process, because every day that you are bleeding and you're going through this is a reminder of what you don't have anymore. What is that coping like, Janet, for someone who, I can imagine wanting to just, for me it was very quick. Within 2 days, the whole process had unfolded.
Right, right. Well, I've seen a range of emotional responses from people, like we said earlier, but, one of the things that I see a lot of is disenfranchised grief. And that's when someone's loss isn't really fully acknowledged by society. They might hear things like, at least it happened early, or you can always try again, right? Oh, you've got 3 other kids. What do you need another one for? Things like that, right? Which really minimizes the experience. And it leaves people feeling unheard, unseen, invalidated. So it's really important whether, you're a friend, a family member, a loved one, a coworker, right? To just check in. There's literally nothing you're going to say that's going to make the person feel better, right? Because you can't take that away from them. But just checking in with them, I'm here. Hey, how are you feeling today? Right? Is there anything I can do for you? That kind of thing. Just constantly making sure that you're available when the person is needing some sort of emotional support. Miscarriages can trigger a lot of trauma symptoms. So a person may be having nightmares. Maybe they used to be really cool, calm, and collected before, and now they're always anxious, right? Or they're afraid about going to the doctor for just a regular checkup, right? Medical settings are now off-putting to them. There's just so many different reactions. So it's important to come from what I like to call that trauma-informed perspective, right? Again, whether you're a professional or a loved one, a friend, and just approach them with a focus on safety, right? You're safe with me. You're emotionally safe with me. I'm never going to make you feel like how you're feeling doesn't matter or is ridiculous or, I'm never going to minimize you. You are emotionally safe with me. I'm going to empower you. How do you want to handle this? Do you want me to just sit there quietly with you? I can do that. Right. Do you want to lay on my lap and cry while I flip through TV? We can do that too. What do you need from me? Right. How can I empower you to make the choice that you need to make so that you are healing at your pace? And I think a lot of times that takes patience. We get impatient sometimes, right? And it's like, oh my God, it's been months, it's been years, and they're still thinking about this. We have to be patient and supportive and empowering. And we can do that by, again, just being present.
Yeah. And you said something that for me was like a cultural response that I've seen too, is the comment about, oh, well, you can still have more, or it was only at this time of pregnancy that they, at least it happened early. And like, right, Christina, like that's something
Yeah,
that I feel
absolutely.
because it's not talked about enough, people don't even know how to really like talk about miscarriage or how to comfort somebody who had a miscarriage.
Yeah, and that's what I think is so important. Folks really have to have culturally sensitive care. Like that's so essential because they must provide like understand the respect. Right? People have diverse beliefs about miscarriage, and so being inclusive and having that compassionate support because everyone feels differently about it. I have someone that is very close to me. They named their child Miracle because they had so many miscarriages before that, and right, and so that meant so every time they hear their daughter's name, it was like this is my miracle, right? Because they had so many miscarriages, and so it's understanding and recognizing that grief um, may be expressed differently, and that healing, is very different, like culturally. So we have to be again very culturally sensitive and compassionate, and provide that care when folks come to see us.
And culture, I feel like also plays an impact in um, Dr. Schickler, whether people seek help during a miscarriage or after a miscarriage, or even for repeated miscarriages, right? Whether they decide, okay, I'm going to get a provider to help weigh in and screen me and see what's going on. Have you seen that too?
Yeah, and then it may even impact if they do come and see us what they decide to do. So you're right, like some people really think that it's supposed to just happen on its own, and so they wait and they wait and they wait for it to happen when maybe actually it could have been better to intervene to help their body do it, because they feel like their body's failed. It's supposed to then do this thing to pass the pregnancy, and so intervening might, I don't know, change that somehow. And then as far as people coming in, likely a similar situation. They feel like they just do it at home. Maybe they don't want people to know. Maybe they don't want to go to a medical person thinking there might be some judgment there. So I think through all of it, yes, there's a lot of cultural differences.
What about seeking fertility help, after repeated miscarriages? Because I feel like that's another instance where it's probably very varies person to person and culture to culture whether or not you should have any intervention with fertility or whether you should just get pregnant on your own.
Yeah, I think that does vary from individual to individual. Some people have these very deeply held beliefs that their body's just supposed to do it, and if it can't, it's a failure, when maybe there's something else going on that we as medical providers could help with, that could help increase their chances of fertility. And also, there's nothing wrong with getting fertility treatments. Some people's bodies just need that extra push or extra help.
Yeah. Or it could be something so simple that you didn't know to like screen for, maybe around the time like you're not getting enough progesterone right in your
Yep.
body. And you need some help with some hormonal
Yep.
supplements to help boost and support the pregnancy.
Exactly. Exactly.
Anything else you'd want to add about seeking long-term support, whether it's fertility treatments or testing, or even long-term mental health care too, Janet? Because I know that when you are actively trying to get pregnant, there's so many stressors that come with that, and just like repeated emotional roller coasters that you go through.
Yes, absolutely. So actually, if you don't mind, I'd like to make 2 points, right? Cultural background really plays a huge role in how people experience miscarriage, but also in how they process it,
Yeah.
right? So in some cultures, loss is deeply spiritual, right? There's rituals, there's prayers, there's symbolic ways to honor, the baby or the deceased loved one. In other cultures, it's something that's much more private, almost taboo, right? Where you're expected to stay quiet and be strong, for example. Um, in many Latino and Caribbean families, for example, there's really a mix of faith and silence. So I know in my culture, we're expected to pray for comfort, right? Light a candle, dedicate a song, but not necessarily openly talk about the pain,
Yeah.
right? Um, and that silence can really deepen that wound unintentionally, but it does it nonetheless, right? So, on the other hand, community and ritual are a huge part of healing, right? And it can be very powerful. So we want to make sure that we're creating space to honor the loss. And that's what we do here in our behavioral health department. We're creating space for you to be able to honor the loss, right? And that can look so different for so many people. Just saying the baby's name, giving it a name, right? Having a keepsake, writing a letter, lighting these lanterns and sending it off to the sky, whatever ritual, whatever needs to happen for the person to create space, we are here to help them with that. And it really does help process and integrate the grief, right? And as clinicians, as providers, we all have to be aware of the cultural nuances and meet patients where they are without assuming that one way of grieving is going to fit everyone.
So it's so different for everybody. And I agree with you all. I think the idea is to be respectful and to let people heal in the best way that works for them, because that's different for everybody. Um, I wanted to touch on the expectations of pregnancy, because I think that in society we have this like um, glorified, like just, I don't even know what the right word is, but just like this really exciting outlook on pregnancy, right? Like we get excited, right, when we find out a family member who is trying to get pregnant gets pregnant, and everybody's super happy, and like pregnancy is made out to be this like beautiful thing, and it's such a great thing to happen, and it is, all those are good things, but it's not it's very dangerous. Like there's a lot of things that can happen in pregnancy, and there's a lot of things that we don't talk about. And once you become a pregnant person and you're meeting with the doctors and you're talking about like all these different screenings you have to get, and how you're really in the dark about what's going to happen to you and what can happen to your body. And there are people who develop medical conditions that only existed for them while they were pregnant, and when they weren't pregnant they were totally fine. So I think people there, we need to change the narrative on the expectations of pregnancy, and that yes, you can celebrate all the good things this means for you if you were hoping to get pregnant, but also understanding the risks and the realities of what pregnancy really is. Does that come up for you all too? Because I feel like it's not talked about at all, like how scary it is. I was terrified every day of my pregnancy.
Oh yeah, I remember when I was pregnant with my second, and I was already very nervous about the pregnancy because I went through IVF to conceive him, and so it was one day I was bleeding profusely, and I got up one morning and I'm bleeding in the toilet, and I was so fearful. But I think, and it wasn't a miscarriage, but also important just having access to care, right? I was so afraid that it was, and I'm thinking about all the things I went through to get pregnant with him, and now at that moment I'm like I'm having a miscarriage. And so um, anytime I go through a situation like that, it makes me think about, gosh, how do people respond when something like this happened, right? I had my doctor's phone number in my phone, and I called him immediately and say, what's going on? I think I'm having a miscarriage. But I had that privilege to call to get that type of access to care, right? And so just thinking of many folks who don't have that, I was there at the office, and he was like, get there before it opens. And so I was able to be seen. And so although again you have this joyous part, those things happen. And what we know about what's happening and what's happened for Black women in pregnancy, all those things are impacted, and people do not receive the care that they need. And so it can be tough. Again, it's joyous, but it can be also very, very scary. I think I was scarier with my second pregnancy because for an IVF and also having another miscarriage, and also saying I just wanted to be there for my first child. I'm like, that brought an additional level of stress for me because I'm like, I've been through this before, but what if I die? Or what if I have a miscarriage and I need to be here for my first child? And so very scary. And that's the stuff people don't speak
Yeah,
about.
we're so grateful for all the advancements in medicine and how much safer,
Yeah.
childbirth has gotten. It's not safe, but it's safer.
I think it's important when we talk about changing the narrative to remember not everyone wanted to be pregnant either. So when we respond, somebody lets us know that they are pregnant and we respond, oh my God, that's wonderful. That may not be wonderful for them. Right. So I think it's important to always check the temperature and, so how do you feel about that? Right. And based on how they're responding, that's when you could share your enthusiasm or not. But just to assume that a person is happy because they're pregnant, right? Like that in itself may also create shame, guilt, right? Grief for them. So I think it's important to change the narrative around pregnancy, but also around pregnancy loss, right? And that looks like moving from silence and shame to compassion and community, right? It's about acknowledging that miscarriage is really a part of many people's reproductive stories, and it's not a failure. It's not something to hide from, right? It means speaking openly about it whenever the opportunity arises, so that we can take that stigma away. And when we talk about how common it is and how deeply people are affected, right? That again, it gives the space for people to share that story and say, you know what, yeah, it happened to me too, right? Like I totally get that. I went through something similar. And again, we're building community, right? And we're getting rid of that shame behind it.
Yeah, it's wild to me that, you ask any woman who has kids, and most of them will tell you their birth story, even if it was awful, even if they were in the hospital 3 days and it was like a long birth, but nobody will tell you their miscarriage story, or very few, I should say, will tell you your
Mm.
miscarriage story. And like, although there was, at the end of a childbirth, hopefully there was, a healthy baby born from that childbirth, and they're sharing that story with you. There's still a lot of value in opening up and a part of the healing process and destigmatizing miscarriage so that people don't carry that weight on their own, and not have anybody to talk to. I think that for me was the biggest thing, is if I had heard more people talk about it when it happened to me, I wouldn't have felt like this is only happening to me. Like I would have been, not to say what you wouldn't still go through your emotions, but you would know like this is a natural part of trying to get pregnant. This happens.
Just letting people know you're not alone, right? Because sometimes when you go through these things, you feel so alone. Even going through infertility, I just felt so alone. And then I formed community, right, with friends who I know who've been through the same thing, and that was helpful for me. So some stuff kept close to my chest because I think culturally, right, people ask tough questions, right? My husband's family's Caribbean, I'm Black American. Oh, y'all been married, y'all ain't had a baby yet until they ask these tough questions. So I think part of that, the shame and the stigma sometimes comes with that because you're almost embarrassed. And people ask all the time. And so the pain of having to relive, oh, this is not happening for me, that makes it tough. But as Janet said, once I found community and felt safe with that community, then I think for me, that's what helped me get pregnant because I wasn't as stressed. I used to cry all the time, like all the time. Every time I would leave an appointment, I would cry, cry, cry. And finally, I got to the space where I was like, I'm only sharing with this, folks. This is going to help me. And then, you know, that was helpful for me, right, when I found community.
And also like, being open to seeking fertility care and treatment if you really are trying to, get pregnant and you're having issues for some time. I think there's a lot of stigma too in seeking fertility care, and I can tell you, I can hear like my late grandmother's voice saying, if it's not meant for you, it's not meant for you. You know what I mean? Like that's the whole like phrase that they, and that's not true. Like there's so many things that you have no understanding of, that if you go see a doctor and you just get yourself checked out, it may be something very simple. It might not, but the end of the story is that there are options. There are always options. um and so yeah, I hear that. I totally hear you, Christina, on just like reading people and figuring out how they feel about things. I think being mindful, in this day and age, when you see a couple together, even somebody who's like, if you get the urge to ask them when are they having kids, don't. You
Yes.
don't know what that, if they are trying or if they're not trying or if they have no interest in trying. Like you don't know that. So let's change the questions, change the narrative, putting that pressure on folks and bringing things up for them when we don't have to. Any
Absolutely.
other thoughts on this? I do want to give an overview that, we do offer all of these services at our Planned Parenthood health centers. We do have prenatal care up to 14 weeks of pregnancy if you're seeking initial care, and we can help you identify ongoing care beyond 14 weeks. Obviously, we handle and offer compassionately miscarriage management and care for miscarriage. We also have basic fertility testing and treatment, which is super exciting. It helps a lot of people kind of get their foot in the door and just get the initial testing, right, Dr. Schickler, to see if there's something going on and there's simple lifestyle changes that we can make or medication that they can go on to help them. And of course, we offer mental health support, through every phase, whether that's you're trying to get pregnant, you're pregnant and you're freaking out, right? Because that happened to me, like not knowing every day what was going to come up, and then postpartum care, because we do want to take care of our pregnant people postpartum as well.
Yeah, yeah, and I think that too, because even for me, I had a little bit of baby blues, but I did have a friend who had a miscarriage, and when she spoke to me about how, because she was pretty far along in her pregnancy, she still, milk developed and all the things, and I never thought about it from that perspective and how what she had to go through. So again, just being mindful, being compassionate, being thoughtful of those questions that you ask, because you never know what that was like. And so she was like, I had every experience of pregnant, even after giving the birth, because again, she was 30 something weeks, but I had all the emotions that came with it, but I just didn't have the baby. Right. I had the things. And so it just
Yeah.
made me look at it from a different perspective. Like, wow, that's, and to, but yeah, that's why I'm like, I just look at miscarriage differently and just very mindful of the questions, right? Whether it's miscarriage, whether it's infertility, um, just be very mindful of the questions folks ask, because it can be painful.
And I just wanted to share, we can honor loss without being defined by it. So, I know sometimes we are afraid to heal because it feels like we're doing something wrong. We're leaving them behind, right? Like we're losing our connection to them. Healing does not mean that you're forgetting, right? It just means that you're integrating that experience into your story in a way that allows you to keep living and loving fully, right? So, as Michelle said, we do offer counseling, but whether you're looking for counseling information or just reassurance that what you're feeling is totally normal, right? Like we're here to help you with that. We're here to help you on your healing journey.
Thank you so much. I appreciate all of you. Let's be brave about sharing our stories and where we come from and what we go through to help others. Absolutely. I appreciate all of you. I hope that you took something away from this podcast episode. We know it's a heavy topic and something that, we're trying to break the stigma, break the barriers, have more folks talk about it. I think that's when we really get to change the narrative around pregnancy and pregnancy loss, when people tell their truths and tell their stories. I appreciate each and every one of you. Please check us out online. Our website is ppfl.org for Planned Parenthood of Florida. And you can check us out on all of the social media platforms. We're pretty much everywhere, PP Florida. Check us out, and we'll see you on the next one.
Bye.
Thank you.